So you finally thought it was a good idea to get counseling. Maybe you've struggled for a while with anxiety. Maybe there's relationship problems going on. Maybe there's an addiction that you have that you really want to get grips on, and you say, today's the day. Today's the day that I finally want to go to counseling. Now what? What are the next steps? What are you supposed to do? How do you call and set up that first appointment? Do you have a preference regarding your counselor's gender? Does your counselor have to have a certain worldview, a certain religious preference? Do you have questions regarding how to set up the appointment? How much is it going to cost? What to even look for? What credentials should your counselor have? Have you thought about these things before? Thanks for joining. Let's follow along. When I say the word counseling, what comes to your mind? Is it something along the lines of somebody laying in a couch and just telling somebody all of their problems? Is it something along the lines of somebody trying to take control, tap into your subconscious? Counseling has come a long ways from the histories back with mesmerism and Sigmund Freud. Counseling nowadays is more of what we call talk therapy. You sit down with a practitioner who's trained, has varied degrees of training in human behavior, and problem solve whatever the issue is, whatever you want to bring up, whatever relationship dysfunction or mental health disorder. Basically, all mental health practitioners nowadays as well take a more non-directive approach, meaning that they involve the client a lot in the process of counseling. They don't come across as being complete experts, basically telling you what to do, telling you what the magic pill is, the magic elixir is. But you, as the client, as the patient, plays a very active role in setting up your goals and in finding your strengths. And with some information, some guidance from the therapist, you meet your goals. And you gather resources and you learn skills to meet what those objectives, those treatment goals are. So what about what to look for in regards to credentials? Maybe you've seen online and there is just a million different job professions that all advertise that they do counseling or mental health work. Here's a little breakdown of some of the most common professions and what their background training is. So at the top you have psychiatrists. Psychiatrists are medical doctors. They specialize in mental health and prescribing psychotropic meds. They obviously have extensive training in how the mental health issues affect the body. And so as far as training, years of experience, at the top of the list, I put here psychiatrist. These practitioners, so their name, they're going to have the MD or the DO. It can typically be really hard to actually book a session with a psychiatrist. Typically, it's going to cost, they can bill the insurance for a lot more. Also, many rural areas don't have access to psychiatrists. They typically deal with more serious mental health diagnoses, and by serious I mean something on the, they're having hallucinations. So we've got schizophrenia, different type of serious mood disorders, bipolar, people that are seriously, I guess what we call quote-unquote psychotic. And then we have psychologists, which are non-medical doctors. So to be a clinical psychologist, you have to have a doctorate, either PsyD or PhD. PhD is more research-focused, PsyD is more clinical-focused. But these people also provide counseling. So if someone has a clinical psychologist title and you see these letters after their name, they have a lot of experience as far as training to be able to do counseling to help with any kind of mental health problem. They typically have to have a bachelor's in psychology to start with, and then postgraduate at least 4 more years and thousands of hours before they, of course, can get certified through their boards and get licensed. I'm sure it varies from state to state, but it's many years. And then at the bottom of the list, we have a lot of them are kind of in the same same level here. Social workers, marriage and family therapists, counselors, basically all of these have more similarities than they do differences. So of course, main differences being with psychiatrists, they're medical doctors, and obviously they are the ones that dealing with medication. Psychologists, just in a few states, 3 different states I believe, they actually can prescribe a few medications, but that's very much regulated. Typically psychologists do not prescribe medications, so if medications are part of the recovery process, depending on what you are wanting to seek counseling for, that may be important or not. So then down here, as I was starting on earlier, we have social workers, marriage and family therapists, counselors, and of course I'm keeping it simple. There's actually more, but all of these they have at least a master's degree, and then they have different acronyms after their name once they get licensed. So a social worker that's licensed to be a counselor is LCSW. So this is definitely preferred. This means somebody has not only a master's degree in social work, but they have thousands of hours, they've taken tests, they've gotten certified, they are licensed to LCSW to do clinical work. Same for marriage and family therapists. All of these have to have tests and a lot of hours of postgraduate clinical work. So licensed professional counselor, so LPC, is with the acronym after the counselor. So all of these also provide, and actually these master's level clinicians are actually the ones that do most of, I think, what we envision, quote unquote, being counseling and therapy. And of course, quick caveat, it's not to say that these are exhaustive by any means. There's many other titles of people that do mental health work. I can't even get into the video because there's a lot. But all of these people can provide counseling. What's the difference between these? Very little. A social worker may be more trained as far as how to involve, the more holistic approach as far as involving community resources into the mix, more of what we call case management, which is basically plugging you into community resources, groups, having supports through family, through the community, getting you plugged into community events, community resources. I think I've repeated myself, but that's more of the training, where counselors and maybe marriage and family therapists is more of an emphasis on the clinical work. But obviously, social workers are equally adept at doing clinical work. And I think marriage and family therapists and counselors as well can obviously train to also provide community resources to people in their clinical works.